Why are we spreading all this misinformation about women's health? We're then just leaving them to their pain. We're leaving them to their hemorrhagic bleeding. We're leaving them to anemia. We're leaving them to all these kind of crazy things that they don't need to be suffering from because there's literally a solution right in front of you. That's why it's so important to not say things like, you're going to get breast cancer because of all of this. You're going to get a tumor because of all of this. You need to not take hormones because it's going to cause those kind of things. Hi, off the charts. It's me, Bobby Parmar. I am so excited to talk to you about estrogen today. We're going to go over a lot of what I think is the confusion. No matter how many influencers out there are trying to sort of set the record straight on whether estrogen is evil or estrogen is like an angel, whichever version of their conscience is talking to their brain, I want to try to explain all of it so you understand like how we got here, why we think the ways we do, just to create some more context and give you a bit more confidence about this topic. So we're going to go over a number of the different things related to one specific thing that everybody thinks about when it's talking about estrogen, and that's breast cancer. It really helps understand what estrogen is about. And we're going to talk a lot about the risks of estrogen on breast cancer. And there's going to be a lot of like specific scenarios that might be really specific to you, like having babies, if you breastfed, if you don't have babies, if you have an IUD, if you are on oral birth control, if you're not on oral birth control, if you have breast cancer in your family. I'm going to try to cover everything. And hopefully it leads to a wonderful understanding of what this is all about. Okay, so we're going to start with some scenarios that might be something that you're having to deal with in your own life. Okay. Scenario number one.
So does estrogen actually cause breast cancer?
Okay, this one's so important to understand. Thanks for the ask. Estrogen plays two different roles in our lives. Estrogen exposure over a lifetime from inside the body, the amount you make when you're ovulating, the amount you make through your tissues, the amounts that get converted, all of that has a negative risk on breast tissue over time. So the longer you have exposure to your own estrogen, the more chances that estrogen has to like mutate cells, cause it to divide. And when you divide cells, you can get cancers because essentially cancer is nothing more than like an error in mutation. All kinds of things can cause that kind of error. There's a difference though. Like when we're talking about lifetime exposure to estrogen, that definitely causes and is a risk factor for cancer. There's no ifs, ands, or buts about that. There's all these kinds of people out there who are saying, like, no, estrogen is totally fine. Stop talking about estrogen. And they're talking about giving a person estrogen. That's totally different. Like, this is very important, ladies. When you give a person estrogen when they're in perimenopause or when they're in menopause, you are no longer giving them enough like their body used to be making over an enormous amount of time, decades, to actually make a difference, especially for breast cancer, especially if they're no longer producing their own estrogen, like when they're no longer ovulating, like when they're in menopause. The difference is when estrogen used to be causing these mutations, when the there's a desert now of estrogen, like you're deprived of estrogen, giving back estrogen on a deprived body does the opposite. It actually makes you less likely to get breast cancer. I know that seems like it's such a puzzle. Like, what an enigma. I mean, it's called the mental puzzle for that reason, but it's real. Overall in life, estrogen causes cancer when it's in your own body, even though they're the same chemical. When you don't have it anymore, it no longer does that. It does the complete opposite. What a paradox. It prevents breast cancer because when you don't have your own estrogen, it then turns on these other signals amazingly that actually down regulate the ability for it to cause these mutations to happen. So when a lot of doctors are saying, don't worry about menopausal hormone therapy or hormone replacement therapy causing breast cancer, when you give a person estrogen, it has a 22, 23% reduction. That's enormous. What in a massive number. You aren't going to get breast cancer as a result of the estrogen that you're given as a menopausal replacement. That doesn't mean that estrogen wasn't causing you to have cancer the rest of your life when you made it yourself. That's the difference.
Wait, what? So our own estrogen is the problem? Like poison?
Yeah. So like when that's the thing, it's not like here's the thing. So, okay, you're not poisoning yourself. We shouldn't put estrogen in this like dark villainous category, like it's a toxic evil thing. It's wonderful. It does all these wonderful, wonderful things. Like it prevents osteoporosis, it prevents dementia, it prevents colon cancer, it prevents a person from losing muscle mass. It literally is, you might as well call it the fountain of youth. I mean, we don't for other reasons, but for mortality purposes, it's wonderful. But for this one thing, for breast tissue over time is just like, oh, you're like, there's too much of you. You've been like grabbing at me and poking at me for so long. I like just stop. And those pinches, those pokes, those result in these kinds of physical changes that can result in inflammation and just these mutant changes that create tumors. That's the difference. We shouldn't call estrogen bad, though. It's a risk factor for cancer.
So, does breast size matter for breast cancer?
No, this is another really interesting thing.
Okay.
So, size of breasts don't matter here because it's not like you have just because you have more breast tissue that you're gonna end up having greater risks of breast diseases. It's density. Density isn't size. Density isn't size. Density is not felt. You can't grab your boobs and be like, "Oh, I have like a dense breast." There's no way you can grab them and be like, "Oh, they're like riper this time of the month or they're riper at some other age." Like you can't do that. You have to X-ray for density because the denser your breast tissue, and a lot of women are told this when they get mammograms, A, B, C, or D. C and D are more dense. You can't feel that. You can't touch that. You can't press that. You don't know. Everything else, however, size, shape, none of those will make a difference for what impact there is with cancer. It's just density because the denser the tissue, the more likely it's going to actually hide a tumor because you can't see it properly on an X-ray. And dense tissue is in and of itself more prone to create tumors. It's dynamic tissue. It's just as denser in a way that can create more of these inflammatory changes. That's the difference. But size here doesn't matter. Okay, ladies, look at this wonderful graph chart. This is where we're going to reference all kinds of things that happen to you in your lives. This is how we're going to tell you whether or not you are at risk, more at risk, or less at risk because of where you fit and what kinds of things you have going on in your life. I just mentioned density. You can see here that the more dense your breasts, the way more likely you are to have risks of breast cancer. It's like a 2 to 4 increased risk, like 2 to 4 relative risk. So 2 to 4 times more than another person who doesn't have dense breasts. It says 26% or more with more dense breasts than 11 to 25% with less dense breasts. That's kind of a big deal. So next time you get a mammogram, just make sure, like so many of my patients don't do this. They have no idea. I ask them every day, today, yesterday. I'm just like, what's your letter? And they're like, what are you talking about? I just get a letter in the mail. I just like, what the letter for density. And I don't know if this is universal across different countries, but here in Canada, we often should be letting women know what their density is. So A, B, C, or D, C and D being more dense. And then, like you probably need to get like more likely to get regular mammograms, maybe yearly. Maybe you need ultrasounds on top of that so you can see the tumors better because the X-ray isn't able to kind of see through that density.
Okay, I have a question.
Oh yeah.
Can density actually change as you get older?
Yes. Paige, thank you for the wonderful questions. Density changes over time as you lose hormones. So as you go through menopause, your density becomes more fatty, and so it essentially becomes less dense, which is why it's easier to see cancers in less dense breasts, and you can pick up more cancers past menopause because they're just less dense, and so you just catch it more as a result of that. You can also essentially give density back. It's not necessarily what we want to do, but we can by putting a person on hormones, you can make some increase in density. So if you had like, I'm going to give really weird numbers, not going to make any sense to you, but like 60 centimeters squared of density, you can add another like 5 to 10 square centimeters of density by giving a person estrogen and progesterone, which means they still need to get monitored because they're now on hormones and that can make it a little bit harder to see. But when you are in menopause, that 60 usually goes down to 30 or 40. So you like go down by half. There's a huge difference. But again, women would never be like, "Oh, my breasts feel so different in menopause." It's like, "Well, no, because you can't feel density." So
And what about alcohol? Does it really raise breast cancer risk?
I mean, you can see by our lovely chart here that it does. It's a 1 to 2-fold increase than if you didn't consume alcohol. Now, this is, like, really important because we speak honestly about this. So many women are going sober now. There's, like, this, like, really amazing tsunami of, like, sobriety, even when there wasn't some kind of disorder associated with it. Just women are learning that alcohol does have these negative impacts on them in reference to their, like, hormones, and they can often feel like they feel better when they don't have it, but that doesn't mean you have to stop drinking. It's just relatively, there's an increased risk, and it's no different than having a relative increase of eating an extra couple of, small fries from McDonald's in a week. Like, we have to explain these kinds of things in order for people to be able to decide for themselves what they actually want to do to change in their lives in order for them to make meaningful changes. If you have 10 different risks and you're like, your mom had breast cancer, your granny had breast cancer, you have some of the genetic predisposition for it, you have very dense breasts, you've had biopsies before, you've been told you have atypical breasts, you have a long exposure of estrogen in your life, more than most other women because you got your puberty earlier and you went through menopause later. Maybe alcohol for you is an enhancing risk factor. Maybe for you, alcohol becomes a problem. And there's a great way to describe this. So I'll just say this. Okay. So last year I did this podcast as a guest. And one of my quotes kind of went viral. There's like 4 or 5 million views on it now, which is kind of crazy. Like influencing. But the reason it went viral is because there's this like controversial, apparently part of it where I say that basically smoking a bunch of cigarettes is equal to drinking a couple glasses of wine. And people were just like, "What are you talking about?" And I was like, I had to like kind of afterwards clarify this, and I'll try to clarify it now. So I'm going to show you this lovely graph. You're going to see on this graph the number of cigarettes per week versus a bottle of wine per week. And it was a comparison of cancer risks between alcohol and tobacco. How many cigarettes are there in a bottle of wine? And overall, different cancers have different risks based on whether you smoke or whether or not you drink. In this study, they showed that if you're looking at breast cancer only, you have what is equal to a bottle of wine a week is, 4 glasses. That's like 80 cigarettes a week. 80 cigarettes a week is the same. That's not lung cancer, that's not, like, dying, that's not mortality. For breast cancer specifically, alcohol has a unique effect on breast tissue that is equivalent when you're drinking a bottle of wine a week to 80 cigarettes a week. You can read this study. I'll link it and everything. It is so fascinating. I'll actually read part of it. If 1,000 women each drank 1 bottle of wine per week, 8 women would develop breast cancer as a result. That's the effect of alcohol. You might be like, "Ugh, that's not that big of a deal. Like 8 in 1,000 for 1 bottle of wine a week." You might just be like, that doesn't even, like, who cares? I'm going to enjoy my rosé all day. Fine. But for another woman, it might be like, actually, that's too high for me. And you get to decide that. We just have to be honest about it.
And does it matter what kind of alcohol it is?
Probably not. It's probably all alcohol because alcohol is a technically a carcinogen, technically, but all that means is that it's like the sun. The sun is a carcinogen. It's like fries. Fries are carcinogen. It's like all kinds of things that we wouldn't normally think about have the ability, even though the risk is really, really low, to create cancer. And this is no different. Alcohol is the problem. It's not the wine versus the hard liquor versus like the vodka or whatever. It's like it's all across the board. They just studied wine because that seems to be the drink of choice.
Interesting. So if you already have high estrogen exposure or dense breasts, does alcohol make it worse?
It's worse for those. So like if you have high density and you have high estrogen level exposure over lifetime and you've been drinking a bottle of wine or more per week, now you're compounding. Like you're just adding things on top of everything, creating like a Eiffel Tower of sorts.
So if someone stops drinking, does the risk go down?
If you stop drinking alcohol, absolutely. Is there like a already some damage done? Yes, girl. Like we can't avoid that. You can just reverse all of eternity and the exposure of things. But it still helps. You can stop drinking and it will still help heal tissue that isn't no any longer getting chronic exposure to this damaging thing because now it's got a break and has the ability to heal. Maybe you can do things to help encourage that. I mean, that may be another podcast episode, but not for today.
Taller women are more at risk? I didn't even know that.
I know. I know, shocker to the taller ladies, the Nicole Kidmans of the world. It's just a thing. There's, like, explanations as to why. If you're 5-ish inches taller than the average woman, you have a 30-ish plus percent increased risk of having breast cancer relative to the other woman. And that is because hormones, when we're growing up, w the women who experience, like, growth spurts, the hormones that create growth spurts grow shit. And what also grows? Tumors. And so, like, you get these things like insulin like growth factor and growth hormone. Like, if think about it, like, if your body is expanding and growing at faster rates, it's also increasing the likelihood that you're gonna grow other things over time, and you can have that be seen. This doesn't mean that, like, all tall women have to be like, "Oh my god, if somebody chop me off at the knees." Like, it doesn't have to be like that. It's just another risk. It's not a huge risk, but it's additive. That kind of woman might want to be a little bit more if she has other things going on too that are related to risks, a little bit more aware. I better not miss my mammogram for 6 years. Kind of deal.
And is that just for breast cancer or does height affect other cancers too?
Your height is definitely linked to risks of all kinds of conditions because we know that when a person has out of control height growth, there are certain diseases, like one's called acromegaly, that growth hormone is now, like, causing lots of, influence on tumor growth as well. So, height is implicated in lots of different conditions. There's, like, all kinds of weird, like, pneumonias and things like that that are related to, like, taller women as well. This is very strange, like, there's this hot tub pneumonia that tall, skinny women get, and it's believed that it's because the thing that also happened that made them tall and skinny also affected their lungs and, like, their lungs' ability to sort of, like, not retain this kind of bacterial infection, and it was, like, the ripe environment for it, and so they're more likely to get, like, a lung infection. All kinds of different biological factors are risks for things.
Does childhood nutrition play a role in this?
Nutrition, there's, like, a balance thing, right? Nutrition also matters. How you eat, what you eat matters, and a lot of the things that help us grow are healthy for us, but that doesn't mean that there isn't a balance there. Like that if you have growth spurts that might have been fueled in part by having good food and good nutrition, doesn't mean that the hormones that were also part of that don't have some kind of future effect. It's just a part of this like Libra scales. Like there's no such thing as a perfect design, right? Like it doesn't mean just because you're 6'2" doesn't mean you're gonna evade all kinds of diseases for the rest of your life. No, girl. Like that's not the way it works.
So let's talk pregnancy.
Ooh.
So the age you have your first baby, that really affects risk?
This one's kinda crazy and kind of dramatic and extra. A lot of people, like, react and kinda overreact to this one, but, like, here we go. So, yes, what's built into risk calculators is how old you were when you had your first baby. Basically, this was a bit controversial because whenever I've told groups of people, women, this, I say, like, "Oh, if you've had a baby after the age of 25-ish, um" and you didn't have one before, your risk of breast cancer is more than a person who didn't. And like, in like medicine, we call these women who have babies after the age of 35, like, God, it's so inappropriate, but like, I'll say it. We call them geriatric pregnancies. Like, my God, how horrendous. Like, you're some like old bearded witch. But like, it just means like advanced maternal age. Like, things start to happen that are consequences to both the pregnancy, the mom, and the baby after the age of 35. But for breast cancer risk, it's actually around 25, maybe 30. Like we haven't really decided what the real true threshold should be, but it's closer to 25 probably. Where if you've had a baby, and like everybody's like, if you're a woman watching this, you're just like, but I had my baby at 27. Does that mean I'm gonna get breast cancer? No, No, I'm not saying that. I'm saying your risk is slightly increased 1 to 2 times more than women who didn't from your baseline. That if you had a baby for the first time after that age, your cells previous to that, breast cells, were really, like, robust. They did this thing called differentiation. They, like, really made themselves into these really strong versions that were kind of, like, resistant to mutating and turning into cancers. After the age of 25, that doesn't seem to happen anymore, and you get more likely these, like, mutations, like I said before, where it's more likely for it to turn over into other things, like cancer cells later on in life, as a result of that, and the older you are after the age of 25, the more kind of harmful it is in this way. And a lot of women are just like, "Should I not have a baby after the age of 30?" It's like, "No, no, have your baby." Like, there's it's just with this one specific thing that there's a higher probability of having, like, these abnormal cells accumulate because of these gene errors that are as a result of aging, and that adding big bursts of estrogen on top of that causes a compounding of the DNA damage in that tissue. And that is why there's an increased risk of having breast cancer when you've had a baby above the age of 25, but definitely above the age of 30. That again does not mean, girl, like, have your babies. However, if you had 5 babies after the age of 35, you need to check your breast. That is the point.
But what about women who've never had kids? How does that affect the risk?
Women who never have children is also a very, very important fact, but we call that nulliparity, and the reason that that also increases breast cancer, and this kinda makes sense when you think about it, when you have, no break, like, in a pregnancy or no break from estrogen to breastfeeding, we'll talk about that in a second. You are ovulating, lots of estrogen is being produced, you didn't get this time where you didn't produce that estrogen, high peaks of estrogen. You then have none of this, like, wonderful protective effect that's goes on the breast tissue if you had a baby before the age of 25, and so you get, like, less maturity of breast tissue as a result of not being pregnant, and you don't ever get this, like a lot of women will say when they get pregnant, they kind of feel, and you technically are, like a different person after you're pregnant. Like, your physiology is different, the way you operate is different, your receptors are different, the way your body was, the how your periods looked, whether you clot, not clot, you're kind of like a different woman. And, like, you have different, symptoms that show up. Some people who would like endometriosis, really heavy periods, terrible pain. After they have a baby, they're like, "I don't have that anymore. I get totally regular periods that are totally fine because this huge hormonal reset happens that then causes, like, we'll call it down regulation, all of the proliferation of these mutant cells, that goes lower as a result of this reset that happens. This is at least our understanding in medicine. When you do not have babies, you don't get any of that. Again, that doesn't mean there's a reason for you to go have kids. It's just we use that as a risk calculation as well in those people. So we call it nulliparity increases your risk of breast cancer too.
And breastfeeding, does that lower the risk?
Yes. So this is like magical. Like as a person who will never breastfeed and who has never, it blows my mind for many reasons. But what happens from a breast cancer perspective, what do you actually think, Paige? Like, what would you think? Would it cause or be an increased risk of breast cancer by breastfeeding, or would it not be?
I mean, I feel like it has to have an impact, right? Your body goes through so many changes to make milk. But I'm not sure if that makes the risk higher or lower.
Okay, great. So let me try to clarify this
Okay.
milky situation. That's so when you're breastfeeding, you're producing all kinds of other hormones. One's called prolactin, what some are called steroids, insulin. They all kind of like flood the breast tissue. And you also have like what's called the destruction of lobular tissue or alveolar lobular tissue, which causes there to be this crowding out. Like you can no longer have room for estrogen. Remember I said before, estrogen exposure over a lifetime is a risk factor for breast cancer, but it's in your own body. And you make it. You get these breaks. Breastfeeding is a break. The other thing that happens in breastfeeding, not only is a break from you ovulating and producing these high amounts of estrogen, it's also a break in that there's this crowding out effect that all these other hormones that make it so that you can produce the milk are also making it impossible for estrogen to have a home in the breast tissue, which means estrogen can't have an effect locally anymore if it's not allowed to live there. Like she doesn't even go here. And she doesn't have any of this like mutative effect anymore because she doesn't even live there. It's become inhospitable to estrogen.
And what about the women who can't breastfeed?
Of course, there are a lot of women who aren't able to breastfeed. Remember, the risks here are like low. It's not like an absolute that if you didn't breastfeed, that you're going to get breast cancer. It's if you didn't breastfeed, you have a 1 to 2 time risk versus if you did, the for breast cancer specifically. Remember, like, the math has to math here, the math has to totally equations matter, and they're all additive. It's just another thing that if you added it to your checklist, like, check, you should probably get the mammogram. We should probably be aware of your breast health and your risks. We should probably put it all into a calculator and see what your specific risks are and how they add up.
What about IVF? Does that change anything for breast cancer risk?
No. There's no known increased risk, of going through those, high doses of hormones and, like, all those physical changes unless the reason the person needed IVF, there was something about their fertility that was part of a disease process that also made them more at risk for cancers. That's the exception. The IVF itself is not like a predictor in that way. But, like, we'll talk about other estrogen exposures and hormone exposures with, birth control and IUDs too. Why don't we get to that right now? Okay, you guys, there's so much. So many women are asking me, IUDs, hormonal IUDs, and oral birth control pills. What is their relationship with breast cancer? Okay, here we go. IUDs first. IUDs are not associated like, they're getting such a bad rap lately. I don't know where this is coming from. I think somebody's just, run with some article somewhere about IUDs and breast cancer, but, like and just, bad things in general, but, like, they're really safe. They're really helpful. They really prevent lots of pain and not having a baby unwanted, like, all of those kinds of wonderful things. I think IUDs are incredible. Full disclosure, I own an IUD clinic, so clearly biased, but, like, the bias is that I want to offer this kind of service to women because I think it's wonderful. However, the conversation about breast cancer. What happens if you put an IUD in? Are you going to have increased risk of breast cancer? Well, no, it's been studied. If there is any risk, there's one study a couple years ago from Denmark, I believe, was like, we do see an increased risk, but the number is so low. It's 14 and 10,000. Whenever we talk about risks, like 14 and 10,000 is 0.014%. That is like, we would never have conversations with each other about like, "Oh, don't cross the street. It's 0.014% chance of getting hit by a bus. Like, just don't even cross the street." You wouldn't do that. Why would you do that? Like, that's good. But with things like this, they just make headlines and they like people race with them. Here's one that I would say maybe don't race with. You can put it down and leave it at the starting blocks. IUDs are super safe. One of the things that we have as a problem with a lot of these studies that look at IUDs and birth control is women who get them often like visit their doctors more. They seem to be a little bit more like aware of their health. They want an IUD. They want to like have something inserted into their uterus for God's sake. Well, they probably check in with their doctors more. And if you check in with your doctors more, that probably means that you're going to be assessed better. You have somebody's eyes on you. They get to be like, hey, we haven't done a breast exam in a while. Hey, we haven't checked your blood work for a while. Hey, hey, then that reveals that these people end up getting more cancers, let's say like this 14 in 10,000 breast cancer risk from IUDs, but that's because they just happen to see people more that get their eyes on them and their bodies. But that's probably where some of those numbers come from. The number is probably much lower, if not negligible, if you consider 14 and 10,000 not negligible. And oral birth control is very similar. There's no real increased risk And there's positives. You have less risk of ovarian cancer. You have less risk of endometrial cancer. You have all these other things that get reduced, including not having a baby. But your breast cancer risk doesn't outweigh any of that. The risk is basically ultimately negligible.
So with a hormonal IUD, how does that affect breast tissue when it's working mostly inside the uterus?
Fabulous question, Paige. So, anybody out there, like any other ladies out there who've had an IUD, and in the first couple months, they're like, why am I moody as F? Why am I breaking out? Why am I depressed? Why am I getting headaches? If the IUD didn't, in terms of the amount of hormone, leave the uterus, how could it possibly have these other effects? How could it possibly have side effects? A little bit, a fractional amount, maybe 1%, let's say, of the hormone in the IUD, the progestin, it's called. Levonorgestrel is the one that we use here, called the Mirena. I don't know what it's called in other places. There's lower dose ones too, but like in case people get side effects or if in case people just don't want to lose their period, right? The IUD is also one way of just not getting a period in like 30 to 50% of people, depending on which one. So if you get those, it kind of implies that there is a systemic effect, that it does go into the blood, and even that little 1% of it can go into receptors and just go, "Ear, ear, ear," and like it just, ear, it like snaps things and it gets to influence them, usually temporarily, because most people tolerate it, most people get used to it, and then it kind of goes away for most people, but for some people it doesn't. So a little bit does go into the rest of the body.
Honestly, I think a lot of women are just scared because we hear so much misinformation about IUDs or even contraceptives. Like people say they're harmful or they're risky or they're poisonous. So it's really hard to know what's real.
My God. Mary, take the wheel because the IUDs are not poisonous. They, yeah, sometimes like birth control at first, they can have side effects and yeah, they can change your breast density at first and then it kind of goes away. And that's where some of these risks might come from. And yes, do people get side effects from them? Yes, are their insertions terribly painful in some women when they aren't offered pain control or pain management? But by far, they do not cause the problems that people are telephoning about nonstop. Like, no, like they're not the devil. Like, no. It doesn't make any sense, Paige. Like, why are we talking about we're in like an era of like truth and like it doesn't make any sense that we're spreading all kinds of misinformation. And why are we spreading all this kind of misinformation about women's health when we're then just leaving them to their pain? We're leaving them to their like hemorrhagic bleeding. We're leaving them to anemia. We're leaving them to all these kind of crazy things that they don't need to be suffering from because there's literally a solution right in front of you. That's why it's so important to not say things like, "You're gonna get breast cancer because of all of this. You're gonna get a tumor because of all of this. You need to not take hormones," because it's gonna cause all these kind of things. However, we are gonna like we're talking about estrogen over a lifetime here, right? Like we're talking about estrogen, exposure of estrogen. Wait until our podcast episode about what happens when you take estrogen. I already told you it does not cause breast cancer. In fact, it reduces it. But wait till I start talking about HRT or MHT or however you reference it and its effect on cancers, breast, everything else. Like that's gonna be a good one. It's coming up soon. Thank you so much for joining me today. I really had a great time, and I hope you did too. Please share this with a friend or a lot of friends and leave me a review. It really helps promote this podcast. Thanks so much.